How do you know you are getting the safest butt implant? And these are my recommendations. One, you need to make sure you're having a surgery done by the American Board of Plastic Surgery surgeon who's qualified to do this procedure, and they're going to be using a implant that's only available in the United States. And across the world, there's several different brand makers that make gluteal implants. That's what they call it, gluteal implants. The United States is really restricted. So, and the restriction for that is really the structure of what an implant needs to be able to tolerate in the human body, specifically for the buttocks. So in the United States, we have a semi-solid silicone gluteal implant. So it's one piece of poured silicone. It has different shapes, has different profiles, different heights, different widths. It kind of depends on the anatomy of the patient. In other parts of the world have different types of implants, so more like a breast implant where it's an outer shell and there's some kind of silicone polymer gel inside the shell. Personally, I've seen a lot of problem with those type of implants because those type of implants just can't sustain the forces of sitting and jumping and falling, and they just can't tolerate without rupturing. And I've taken out a lot of those ruptured implants. So United States, as of right now, we only have available to our patients is the semi-solid silicone gluteal implants. And so it really depends on the patient, on their look, on what they want to look like, or what type, what form of a gluteal implant that the patient will get. The second thing is that when you have the surgery done, you want to do it in a qualified facility under general anesthesia. This procedure is a little bit more labor intensive and technically more challenging than doing a simple breast augmentation. And so the positioning of a patient is different, the technique is different. It's something that has a higher risk of injury to vessels because it's usually involved with the muscle itself. These implants are placed in the muscle. And so everything needs to be well controlled in a very, very, very sterile environment, which leads me to a point of the highest complication associated with this surgery, which is, if you look at the literature, it's infection. So the part of the body is typically, we would say, dirtier than other parts of the body. So it's very, very, very important that the surgeon has the utmost respect for prevention of infection. So the equipment, the supplies, the implant, and washing with antibiotics, you get antibiotics through the IV, the recovery after surgery, it should be very, very, very protocolized before you choose your surgeon. And I would say the last thing that I would recommend is that you need to prepare for the recovery. The recovery for this procedure is a little bit more labor intensive and uncomfortable than some other surgeries associated to the butt. The most common buttock augmentation surgery right now is called a Brazilian butt lift, or the fat transfer to the butt. And so that's a little bit less, I would say, uncomfortable versus being in the position for a gluteal augmentation with implants. For me, my patients are restricted from sitting or laying on their back for 2 whole weeks after gluteal implants. Now you're gonna say, well, Dr. Morales, I'm told that I can't sit or lay on my butt with fat transfer alone or BBL. Well, that's your surgeon, but I'm gonna tell you now that with fat transfer alone, I'm okay with you sitting on your butt. I'm okay with you laying on your back. It's not gonna be any consequence. Implants are different. Implants, the space has to be very controlled. It cannot be moved. It cannot be manipulated. So I restrict my patients for 2 weeks. And so for many patients, especially who are out of town or coming from different parts of the country, that's a little bit more of planning ahead of time in their personal and work life. They need to take that time off for 2 weeks. They need to come over, have surgery, and I can keep them close to me and watch them in the recovery during the initial recovery phase. And at that point, I can send them back into a part of the country to go to. So those are my 3 recommendations. And if you're considering gluteal augmentation with implants, the key is safety. Stay safe.